Assalamu alaikum. Now I would like to discuss on water deprivation test. It's a very high yield topic and it is important for diagnosing diabetes insipidus. First, go with these steps. An 8-year-old boy is brought to the office due to why? Excessive urination, more than 3 liter maybe. And he is irritable and restless, this and that, and here and there. His sodium, very, very important. Sodium is 142. Potassium, normal. Other vitals, creatinine is normal. Calcium is normal too. Specific gravity. Okay, the most important thing here, urine osmolarity is 120 milliosmol per kg and urine output is more than 3 liter. So what is your diagnosis? Urine osmolarity is high, serum sodium is uh, kind of normal. So I think that it is primary polydipsia. So I want to do water deprivation test. Okay, now patients with like this, patients with polyuria, in case of adult more than 3 liter per day, in case of children more than 2 liter per day meter square. If the urine is concentrated more than 600 milliosmol per kg, if the urine osmolarity is more than 600, then water deprivation is not needed. Why? Assess for solid diuresis like glycosidia, maybe early onset diabetes. So if urine osmolarity very very high, if urine osmolarity is more or equal 600, so no water deprivation test is indicated. That means in concentrated urine you do not need water deprivation test. But in case of dilute urine, what we'll do in case of dilute urine, if urine osmolarity is less than 300, the half. If urine osmolarity less than 300, in here in this system, this patient's urine osmolarity is 120. So it is less than 300 milliosmol per kg. So it is dilute urine. And then the next thing, what you will see, you will see the sodium. Dilute urine, then sodium. If urine sodium, sorry, if the serum sodium is less than 125, sorry, if serum sodium is less than 145, if serum sodium is less than 145, water deprivation test is needed. In this patient, serum sodium is 142. So in here, water deprivation test is needed. Why? We are doing water deprivation for looking at what AVP disorder versus AVP disorder, arginine vasopressin disorder versus primary polydipsia, AVP versus PP. If serum sodium is more than 145 and plasma osmolarity is more than 295, serum sodium is more than 195, serum sodium is more than 145 and plasma osmolarity is more than 295, then water deprivation test is not needed. We know that AVP disorder is confirmed, like it is either central or cranial diabetes insipidus versus what, it is on central or central versus nephrogenic diabetes insipidus. If you give desmopressin, if you give desmopressin and the osmolarity is increased, if you give desmopressin, if the patient responds, then it is central diabetes insipidus. If you give desmopressin but it is not reactive, it is nephrogenic diabetes insipidus. So urine osmol So look at here, this patient has polyuria, dilute urine. This patient has polyuria, dilute urine less than 300 milliosmol per kg, and urine specific gravity is less than 1.006. This is also very high yield. Urine specific gravity is less than 1.006, which is important. So urine osmolarity is low, less than 300. Specific gravity is low, less than 1.006. It suggests suggesting AVP disorder. It is suggesting an AVP disorder. However, the serum sodium is normal, 142. So, which is common when a patient is able, which is common when the patient is able to drink sufficient water to replace losses. In in such cases, water deprivation. In such cases, when you are in a dilemma, like urine osmolarity is low, urine specific gravity is low, looks like AVP disorder, but serum sodium is normal, not more than 145. So in such cases, water deprivation test can distinguish between AVP disorder and primary polypsia. If urine, if water is restricted and the serum if water is restricted and serum osmolarity if more than 295 milliosmol per kg and serum sodium is more than 145, which is normal, which normally triggers maximal AVP secretion. An appropriate rise, of the urine, an appropriate rise of urine concentration more than 600 milliosmol per kg. This is primary polydipsia. If persistently dilute urine, if persistently dilute urine, that means less than 300 milliosmol per kg, not more than so less than 300, it is AVP disorder. If urine also remains dilute following administration of desmopressin, an AVP analog, then it is AVP R, that means nephrogenic diabetes insipidus, which in children is most commonly due to like hereditary disorder. The water deprivation test is performed in the hospital in supervised in older children and should not be used in young children due to risk of severe hypernatremia. So that is all about water deprivation test. Hope you enjoyed.